Idiopathic Pulmonary Fibrosis, or IPF, is a serious lung disease that affects the lung's ability to function properly. It causes scarring in the lungs, making it hard to breathe. This scarring, known as fibrosis, thickens the tissue around and between the air sacs in your lungs. The word idiopathic means the cause of the disease is unknown. Despite extensive research, the exact triggers for IPF remain elusive. IPF is a chronic condition, meaning it lasts a long time and gets worse over time. Patients often experience a gradual decline in their ability to perform everyday activities. The scarring in IPF affects the tiny air sacs in your lungs called alveoli. These alveoli are crucial for the exchange of oxygen and carbon dioxide. These air sacs are responsible for transferring oxygen from the air you breathe into your bloodstream. When they are damaged, this process is hindered. When the alveoli are scarred, they can't work as well. This leads to a decrease in oxygen levels in your blood, causing shortness of breath and fatigue. This makes it difficult for your body to get enough oxygen, which is essential for your organs and tissues to function properly. Managing IPF often requires medical intervention and lifestyle adjustments. The most common symptom of IPF, or idiopathic pulmonary fibrosis, is shortness of breath. This can be particularly noticeable during physical activities. You might notice it first when you're physically active, like climbing stairs, walking briskly, or even doing light exercises. These activities can become increasingly difficult. As the disease progresses, you might feel short of breath even when you're resting or doing minimal activities. This can significantly impact your daily life and routine. Another common symptom is a persistent dry cough that doesn't go away. This cough can be irritating and may interfere with your sleep and daily activities. This cough is usually unproductive, meaning it doesn't bring up any phlegm. It can be frustrating and exhausting. You might also experience other symptoms such as fatigue, weight loss, and chest pain. These symptoms can vary in intensity and may come and go. In the later stages of IPF, you might notice clubbing of your fingers. This is a physical change that occurs over time. Clubbing is when the tips of your fingers become wider and rounder. This can be a noticeable and concerning change. Clubbing is a sign that your body isn't getting enough oxygen. It's important to recognize these symptoms early and seek medical advice. While the exact cause of IPF is unknown, several factors can increase your risk. Age is a significant risk factor, with most people diagnosed between the ages of 50 and 75. Smoking is another major risk factor. If you smoke, quitting is one of the most important things you can do for your lung health. Exposure to certain environmental factors, such as asbestos and silica dust, can also increase your risk. Additionally, having a family history of IPF suggests a genetic component to the disease. Diagnosing IPF involves a combination of tests, each providing crucial information to help pinpoint the condition. Your doctor will start by asking about your medical history and symptoms, including any breathing difficulties, persistent cough, or fatigue you may have experienced. They'll also perform a physical exam, listening to your lungs for any abnormalities such as crackling sounds that might indicate fibrosis. Imaging tests such as high-resolution computed tomography or HRCT scans are used to visualize the lungs and look for signs of scarring. These scans provide detailed images that can reveal the extent of lung damage. In some cases, a lung biopsy may be necessary to confirm the diagnosis. This involves taking a small sample of lung tissue to be examined under a microscope for signs of IPF. While there's no cure for IPF, treatments are available to help manage your symptoms and slow the progression of the disease. These include medications that can reduce lung inflammation and fibrosis, oxygen therapy to help you breathe easier, and pulmonary rehabilitation to improve your overall lung function. In severe cases, lung transplantation may be considered. This can significantly improve the quality of life and survival for patients with advanced IPF. Living a healthy lifestyle, including quitting smoking and managing other health conditions, can also help improve your quality of life with IPF. Regular exercise, a balanced diet, and stress management techniques like yoga or meditation can make a significant difference.